Hello, my name is Aruna, and I'm a public health officer and research for implementation lead at the International Agency for Research on Cancer. Today, I'll be speaking to you about applying the lens of context to improve outcomes in cancer early detection, illustrating an example from our project, the Access Cancer Care India project. My presentation is broadly divided into two aspects. One of it is what are the contexts that we really need to be aware of to improve cancer early detection outcomes? And secondly, how is it that we assess this context? And most importantly, how implementation research plays a role. Now, context in the cancer early detection pathway is multidimensional. There are multiple level of opportunities and barriers that exist, and we can see this through the lens of service providers, service users, and even the overall healthcare system. The next thing that we should be thinking about is what are our implementation challenges? In our project, we thought about, is it overuse or is it underuse due to the services failing to deliver the intervention to those who would benefit the most? Or is it even misuse, delivering the interventions to those who will not benefit from it? And then, of course, who or what is affected by the current challenges that we're thinking about? Is it individuals? Is it healthcare providers? Is it policymakers, communities, or even the healthcare system? And then, most importantly, how do we assess context and how implementation research can help? Our project is the Access Cancer Care India project. This project focuses on implementation research to design and evaluate a strategy that eventually will be integrated and contextualized to the local healthcare system to improve access of early detection and subsequent care continuum for 3 cancers, which is oral, breast, and cervical cancers among rural population in India. In 3 states, namely Kerala and Tamil Nadu in the southern Indian state, and 1 northern state in Rajasthan. Now, I spoke about implementation challenges earlier. In our setting, one of the most important implementation challenge was late presentation of cancer patients resulting in poor survival, underutilization of services. And then we spoke about who is affected. In our project, we listed all the stakeholders or all the individuals and communities and groups who are affected and who can affect change, namely cancer patients, general population community groups, community health workers, clinicians, program managers, policymakers, as well as healthcare policies and systems. And then we thought about how is it that we can assess the different contexts and the different stakeholders. For individuals, for example, we used surveys. For groups, we used focus group discussions. And for key opinion leaders, we used in-depth interviews. And how we assessed healthcare policies and systems are through policy analysis and facility visits. We then triangulated all the information that we obtained from the surveys, the focus group, the in-depth interviews, and the policy analysis into a SWOT evidence table. We thought about the strengths, the weaknesses, the opportunities, and threats that exist in the context of cancer early detection in our 3 different sites. We then brought this context and evidence to our stakeholders through a stakeholder engagement strategy and co-developed some solutions for implementation, which we will then be assessing through the REAIM framework to achieve our desired outcomes. Remember all our stakeholders? We asked everyone what they thought about the current situation or the current context. We asked the people what they think about their own health. How is it that they access care? What barriers and opportunities are there currently to improve screening behavior? And most importantly, how can we help? And then we ask the patients, how was your journey like? Did they experience delays in cancer care? What were their pain points and barriers to care? And then most importantly, what helped? And would they be willing to share experiences so that we can help future patients? And then we ask the healthcare workers with a core sense of the care system. What is it that they feel about their current work? Are they open to learning innovative solutions if we were to present them? How is it that we can help? And this is a picture of a focus group discussion among women in an area called Asur, where the women came together and provided some of their challenges in accessing cancer care or cancer preventive care, and what are some of the solutions that they felt would help. We also engaged our macro and meso level stakeholders and asked them what is it that the program managers think about the current care pathway and what are their current pain points. Would some of the proposed solutions that we've now brought forward from the communities and the individuals and service providers work? And how is it that we can refine the strategies together? The next step would, of course, to be co-developing the solutions. So how is it that we turned problems into solutions? From our context assessment, we knew that there was fear, stigma, and even poor awareness among the stakeholders and the communities. We knew there was suboptimal training among the healthcare providers. We knew that there was lack of cancer screening services or cancer early detection services are currently ongoing. And even when that service is provided, there is lack of follow-up. And that resulted in limited engagement with preventive healthcare that then turned into late-stage presentation of cancers with poor survival. We used a problem tree to identify the goals and potential intervention and activities. These ideas were then explored with our communities and with our stakeholders to consider their feasibility. At this stage of our project, we will be adapting and tailoring some of the ongoing services. We will be supporting our providers to improve care, and we will be engaging clients through some of the strategies that I earlier spoke about. We will also be using the RE-AIM framework to gauge our success to achieve our desired outcomes. Along the way, the Access Cancer Care India project, in our project, we developed a validated tool for healthcare system that is currently available for use in low middle income countries. We did this very early in our project because we understood that context is the most crucial aspect of developing implementation strategies that will eventually work. The main question for us was, how can we make the choice to undergo cancer early detection the easy and informed choice, taking into account the context of each of our research sites? With that, I'd like to thank you for listening. Here are my contact details. Please feel free to reach out to me if you have any questions about the Access Cancer Care India project.